So for this module, what I'd like you to do is to really focus on reading your book chapter and using your chapter to learn about the basics of pain and pain management. So what are the biological causes of pain? What are the cultural and psychological factors that impact how pain is experienced and how people cope with pain? And how do you treat problems with pain? The purpose of this lecture is to really help you understand why I chose to talk about this topic in this class. It may stick out a little bit like a sore thumb and seem like, why would I choose this topic? But I think there are many literacy issues around the issue of pain, both for providers and for clients. And I also think that pain often interferes with healthcare adherence. And in addition, healthcare adherence to pain regimens is terrible. So the purpose of this lecture is to make those connections for you. Most of us have some common sense beliefs about pain. We all experience pain in our lifetime, and the experience of pain is one that's deeply personal. And because of that, we've all developed some ideas about pain and what it means and how people should cope with pain. In addition, the experience of someone else's pain is really hard to understand because there are so many complex psychological, behavioral, medical, and cultural factors that are at work. And so people's experience of pain varies widely, as does their response to pain. Pain can be a barrier to treatment adherence. Improperly managed pain, as I've mentioned in previous lectures, can result in post-traumatic stress symptoms that interfere with adherence. And poor adherence to pain management recommendations can have serious consequences for patients. I'm going to talk about all of these issues in more detail in this lecture. So let me describe some of the common myths that are problems around pain. And I want to talk about this in the context of a case. So I'm going to give you a hypothetical. So let's say we have a case of a teenager, a 14-year-old boy who has a primary immune deficiency. And what that means is, unlike an acquired immune deficiency syndrome where there was a virus that caused an immune deficiency, this boy has a congenital immune deficiency. So because of his genetic makeup, his body doesn't make all of the factors necessary for his immune system to work well. And he catches every infection and has trouble fighting them off. And ends up being in the hospital all the time fighting things off. And infections that you and I would think would be really minor are really problematic for him. And so he's in a lot of discomfort. So he might have a lot of upper respiratory infections. And so that feels uncomfortable. And he might have to have a permanent line in his body so that he can get continuous antibiotics to prevent those infections from running rampant. And that's uncomfortable. And any nick or cut or rub on his skin doesn't heal like it should, and so that's uncomfortable. And oftentimes people get really uncomfortable ulcers in sensitive areas like genital areas or inner thighs or places that tend to kind of rub or get irritated, and so that causes a lot of pain. And maybe he has some fungus under his fingernails, and that's uncomfortable. And so he just has a lot of things that make him feel uncomfortable all the time, and he's become pretty despondent. And in addition to being despondent, he's become really intolerant of any medical procedures that might be uncomfortable. So he really fights minor things like blood draws and shots, and fights them so much that the medical staff has started to knock him out for those minor procedures because they can't figure out how else to get through them. So here are some of the inaccurate beliefs that might be operating in these types of situations. One is that the team may not be medicating him adequately for his pain. So there are a lot of misconceptions out there about the addictive properties of opioids, and also misconceptions about how medication should be administered. And this is particularly true for kids. Kids have a hard time communicating. They don't communicate as clearly as adults about their pain. They don't have enough experience to know how to communicate about pain or when to be assertive. And people also have some funny ideas about kids and whether or not they should be medicated. And so on top of those misconceptions about pain management in children, many professionals get very concerned about the addictive properties of the opioids, and this is like oxycodone or those types of medications. And certainly those medications can be abused by people who are trying to get a high from them, a euphoric feeling. But what the research suggests is that people who are using them for pain management don't tend to abuse them, and that Rates of abuse among patients who are being treated for pain with opioids are no higher than rates of drug abuse in the general population. Instead, all of the things that we're hearing about abuse of these types of medications seems to be more linked in the literature to relatives or friends who are buying or stealing the medications and using them improperly. Opioids are very effective in managing pain and can help people be much more functional. And so in this particular case with this boy, the treatment team had been really conservative about how they were responding to his pain. And so one of the things that a psychologist or other treatment team member could suggest is whether or not he could use patient-controlled analgesia, which is where a patient has a button and they can self-administer pain medication as they need to. And the research on that is really positive and suggests that people tend to self-administer a very reasonable dose and that this can contribute to good level pain management over time. So if you can get the team past that myth, that might be something they could try. Another thing that often happens is people have these beliefs that you shouldn't move if movement causes discomfort. And there's some truth to that. That if you move and there's pain, that pain's trying to tell you something. However, there are times when movement is really important and in the long run can reduce discomfort. So for example, for this young man, movement might help him to not get so many ulcers because he wouldn't have pressure in the same places on his body. He'd get air to more areas of his body. And so it might hurt to move, but in the long run, it might be better for him. Another issue is that people often assume that only the weak experience severe pain, and certainly only the weak try to get treatment for their pain. And that if you pursue a psychological treatment for pain, like imagery or relaxation, that's proof that the pain was all in your head anyway. And it's really unfortunate because, first of all, when you read about pain gating theory, you'll see clearly that addressing psychological aspects of pain is really a biological intervention in a way. It's a way of getting your brain to focus on something else, which reduces pain. That doesn't mean the pain wasn't real or was all in someone's head. It means that we can use the way we think to redirect our brains a little bit and to manage pain in that way. As a culture, we also tend to assume that people who are more reactive to pain are really overreacting. And so, as you know, there's a lot of variability in how much people react to pain. And so people may assume that this child is just being overreactive, that he's not really in that much pain and he's overreacting, and they may be reluctant to suggest that he do things like imagery and deep breathing and psychological treatment for pain because they may think that means it's all in his head. And what's troubling about that whole idea is that there's some research to suggest that the experience of pain can be influenced in multiple ways, and that one way it can be influenced is by early experiences with pain. So the early experiences with pain seem to trigger the strengthening of a neural network that then becomes hypersensitive, so that things that would cause you or I discomfort cause that neural circuit to go off as though this child was experiencing high levels of pain. This has been shown in premature infants, for example. There are also other reasons people might be more or less reactive to pain. They might have to do with the level of stress they're under or the other medical problems they might be having. It can also be related to culture, to the way folks are brought up. So there are multiple aspects that can really cause people to be more or less reactive to pain, and it's important to recognize that. So I hope that's an example for you about some of the common sense myths about pain management and why they can get in the way of adherence and of providers offering good treatment strategies. And hopefully this impresses upon you how low literacy is about pain, probably in yourself, just naturally through what you've learned through our culture, through healthcare providers and your clients. So as you can see in this particular example, poor literacy about pain and pain management among healthcare providers can lead to inadequate care. So things like poor pain management for the child in that particular example. It can also contribute to disparities in access to adequate pain management. So there's evidence that members of minority groups are less likely to get adequate pain assessment and management, along with children, folks with developmental disabilities, senior citizens, anyone who has trouble communicating communicating about pain or has a pain response that isn't typical because of their medical concern. So, for example, kids with cerebral palsy, people really tend to underestimate the amount of pain that they're experiencing due to contractures in their musculature. And this is because they tend to have either a flat or restricted or unusual facial expressions, and so it's hard for people to know, especially if the child doesn't communicate verbally very well, that they're in pain. So poor literacy about pain management and pain control can contribute to those disparities in access to pain management. And, in addition, poor literacy among patients can reduce adherence to treatment and result in inadequate pain management. And this process where patients don't adhere to doctor recommendations around pain management has been shown to be a partial contributor to some of the disparities in healthcare around pain. I know I've talked about post-traumatic stress disorder in the past, and you may remember that post-traumatic stress symptoms occur when someone's really afraid that they're going to die or be really hurt. And pain really intensifies that experience. And a high level of pain really convinces people that they're going to die. If they're in enough pain, they may even wish to die. And it can contribute to a lot of fear that they're going to die or be seriously injured. And just kind of makes that whole experience more intense, so that people may really develop these intense flashbacks around medical situations that then cause them to avoid treatment in the future. So, some examples of this that have been really problematic in my experience have been kids with cancer. So that sometimes when kids with cancer have poor pain management, they become very traumatized by those experiences, and they may develop flashbacks or physiologic responses to being in a treatment room or being with a nurse or coming to the doctor's office that they didn't have before. And those kinds of symptoms can lead them to avoid doing things that they need to do for treatment. I think I mentioned in a prior lecture that there's a big problem with patients who come in from car accidents and are seen by an adult trauma service. And the adult trauma service may, at times, under-medicate kids because they're not used to working with kids. They don't really understand the situation. And then what happens is that you have a kid who's in a ton of pain and who can develop some PTSD symptoms as a result, and then have difficulty doing things like participating in their physical therapy because it triggers flashbacks and such a severe anxiety response. In addition to experiences where severe pain causes PTSD, pain is just a barrier to treatment adherence. Pain feels like punishment for moving. And so if you remember right, punishment is anything that decreases the likelihood of a behavior. And if it hurts me to walk, I'm not as likely to walk, and I think that's natural. In addition, people can often develop really negative thought patterns about pain because pain is just such a difficult experience. So people may develop some catastrophic thinking about their pain, feeling like it'll never get better and that it means something very seriously negative is happening to their body. So for example, I work with a lot of kids who have sickle cell disease, and you may remember that in sickle cell disease, kids' red blood cells sickle, especially when they're dehydrated or hot or under stress, and that because of that sickled appearance, blood cells get trapped in those little teeny tiny vessels in the body, and that can cause pain. And so one of the big issues with sickle cell patients is that they have pain crises. And so sometimes those pain crises can make kids really feel like they'll never get better. There's something really bad happening to their body, and it can make them think things like maybe they shouldn't move or shouldn't do things because that'll make it worse. And that negative thinking can get in the way of treatment adherence. So when they're asked to do things that might help with the pain, like use a heating pad or do some movement, the kids may be reluctant to do that because they have all these negative thoughts going on that are interfering. And finally, I talked about how improper treatment of pain can result in post-traumatic stress symptoms. Improper treatment of chronic pain can result in learned helplessness. And you may remember that the model for learned helplessness is Thorndike's cat, I think, or dog, that was in the cage where it got shocked no matter what it did. So no matter what it did, it got shocked, and there was no way to prevent getting shocked. And so eventually the animal just sat down and did nothing. Whereas an animal who had a lever that it could push that would work in reducing the shock did just fine and didn't develop that helplessness. Well, people can develop that helplessness too if they have chronic pain and it's not well managed and nothing they do seems to help and it's just bad all the time. Eventually they become helpless and feel like nothing they do will matter, and so why bother? And it can become very hard to get those patients to adhere to their treatments. So, as you can see, poor literacy about pain management and poor pain management itself can result in untreated pain. It can result in things like PTSD and learned helplessness that can get in the way of adhering to treatment regimens. But the question remains, why do we think it's bad? Why do we think it's bad to not treat pain? Aren't people who go without treatment for pain truly tough, and shouldn't we respect that? The reason that untreated pain is something that should be treated is that, pain limits mobility. It limits the ability to engage in everyday tasks, even for the toughest of people. Over time, people who have chronic pain show less overall strength, and their health often gets poorer. It makes it hard to concentrate. Pain impacts relationships, and it can increase anxiety and depression. And the increase in anxiety and depression then fuels the cycle where pain feels more intense, and you get into this vicious cycle. So untreated pain has lots of implications for people's lives. So in summary, pain is a common experience. We're all going to experience at some point. We all know people who have experienced pain. And having pain can impact adherence to treatment recommendations. We might avoid doing things that our therapists or doctors tell us to do because it hurts. We might develop problems with post-traumatic stress symptoms or learned helplessness that make it hard to adhere. We can develop negative thinking about the pain that interferes with adherence. Treatment of pain is necessary because untreated pain can result in a variety of negative physical and mental health consequences, and inadequate treatment of pain can result in greater chronicity of pain and or PTSD symptoms. And on top of that, common myths about pain make it difficult for patients and providers to respond appropriately. So it's important for you to get a good sense of what pain is about, what pain management is about, so that you can teach your patients, address their misconceptions, and make sure that you are doing a good job of treating your patients in a way that minimizes their pain and makes it possible for them to engage in their everyday lives at a high level.